This video has been jointly developed by the EGPRD and Remedi4all project on repurposing for medicines. My name is Rosan Vechter. I'm Rare Disease Community Manager for the EGPRD.
Hello, I'm Eva Molero. I'm founder and CEO of Timid Research, and we are partners in the Remedi4all project, taking care of project management of this endeavor. Here, project management is a well-established discipline that actually what gives you is tools and methodologies to solve the trade-offs that can appear between the scope of projects, the quality, the time, and the cost component. So those are the four variables that play a role within any unique endeavor like that we call a project. And project management is helpful for is to solve the conflicts that can appear when favoring one of the variables. For instance, increasing the quality requires more time or increases the cost. So there are these different interdependencies between the variables that need to be dealt with. When we are talking about projects that are publicly funded, typically we find two variables that are rather fixed by contract, so to say, by the grant agreement, which are on the one side the scope. What we try to do in the project is fixed in the contract because in many cases, it results from a competitive process, right? Public competition. And then typically the cost component is also fixed because there is a maximum grant amount and we cannot go beyond that. So what we should be very careful about is that the quality and time components are the ones which should not be suffering because the other two variables are kind of fixed. We have a layer of risk, unknowns and uncertainties. In any project, there are risks, but in research projects, there are more risks than usual because research is an activity that is risky or as an equivalent of uncertain. There are many things that we don't know. And in these large research projects, scientific coordination and project management are the key components to manage those variables and to manage those risks so that the stakeholders, so the ones affected by the project, can it be partners because they are involved internally, but also end users, citizens, etc., are satisfied that their needs are covered, but also their expectations, which are sometimes implicit and we need to investigate. What typically is covered by project management can vary from project to project and needs to be adapted to the specific circumstances. But basically, there is a part that has to do with the day-to-day management of the project. So dealing with issues or misunderstandings or connections between project components that even if they don't affect the project strategically, they may affect the smooth running of the project. So this is what we call the day-to-day management, right? So that we implement a good work dynamics, that people know a bit what are the rules of the game, what is expected from them, what are the, let's say, the procedures or how to talk and work together. Then there is the reporting and administration, and this has to do with the fact that in many cases, or here we're taking the example of a publicly funded project. So the funding agency would require some kind of reporting showing that the progress of the project is achieved so that the finances or that the grant amounts are disbursed normally in installments, right? So you need to report and get back to the funding agency and explain what is the degree of implementation of the project. And then in risk management, this has to do with managing all these uncertainties and risks that appear during the project implementation. In most cases, we associate this with negative risks, what we call the threats. So we identify something that can have a negative effect on the project. And in this case, we typically evaluate what would be the impact, what would be the likelihood of this risk happening, the proximity in time. So with these three variables, we can assign a score to that risk and then devise mitigation plans to avoid that the risk actually happens, or contingency plans, which is what we will do if the risk happens actually. And then a very important component is internal communication. We are talking here about large projects that typically involve a number of different organizations, and therefore finding the internal mechanisms for engaging, for communicating what is happening in the project is really important to facilitate a good work dynamics, good communication, and also crosstalk between the different project components.
The minimum governance structure for small and medium-scale international consortia includes the following bodies. At coordination level, there's the Project Management Office and the Steering Committee. The Project Management Office is composed of the project coordinator and the project management team, which are accountable for the overall success and day-to-day management of the project. The Steering Committee is responsible for the overall project execution and drives and fosters interaction between work packages. It is standard practice to have monthly meetings for progress updates and monitoring, and the Steering Committee reports to the General Assembly. The General Assembly is the highest decision-making body with one representative per partner. The General Assembly is responsible for the overall policies, strategic direction, and decision-making. The General Assembly meets annually and drafts an annual work plan, which is discussed and adopted during the General Assembly. For larger projects, additional bodies are usually added to the project. In some cases, a scientific operation team is set up to provide operational leaderships to the work packages and facilitate synergies between work packages. Additional expertise is brought into the project via the external advisory boards to advise on scientific and ethics-related matters, as well as data access. A forum is composed of beneficiaries and associated partners. This is the community of practice that should be aware and provide occasional input into the project and act as an amplifier for dissemination activities. When doing research, you have a duty to the patients but also to the grant providers and all involved stakeholders to try and reach the goals of the project. And you need to do that by doing high-quality research, managing the interdependencies and processes as to deliver high-quality research on budget and on time. And generally speaking, rare disease research has to be quite interdisciplinary. Good project management helps you create governance and operational processes that can allow multidisciplinary and multi-institutional work to take place effectively. EATRIS has drafted a research management manual providing general guidance on how to structure and run a translational research project, from project initiation to project closure, to optimize the translational feasibility of your project. It provides a glossary of terms to define a common understanding for the rules and responsibilities of different project roles and functions, a set of templates and procedures to be used when setting up and running research projects, and finally it provides a reference guide for the minimally required quality standards as defined by European and international guidelines. It's also important while drafting your proposal to think about innovation management, meaning whether the project will generate any results that are patentable and how new intellectual property will be handled. It is recommended to create an IP strategy at the beginning of the project that foresees timely monitoring of project results, describing a clear process for protecting new inventions and indicated how joint inventions will be handled. Normally, the strategy is centered on the support of the Technology Transfer Office of the coordinating institution, and so it is recommended to ensure a timely dialogue with the tech transfer and discuss the financial implications. A short practical video on innovation management is available, explaining how to plan forward for IP and legal agreements in such projects, including when best to contact the TTO or file for patent, what contracts and agreements need to be implemented, and what commercialization strategies can be considered for your product. With budget planning, it's also important to anticipate for regulatory filing and regulatory studies. You might need to budget for consultancy or expert advice on, for example, GMP manufacturing, additional studies, or even scientific advice and qualification of novel methodologies from the regulators. It is therefore important to set aside a budget for subcontracting for the innovation management and/or regulatory expertise in the range of 40 to 50K. It becomes increasingly important to engage with patients in research in a meaningful manner, to encourage fruitful and enduring partnerships between scientists and patient organizations, co-leading the way for systematic patient-centered research. This can be done at different levels and in different formats, through consultation, active engagement, collaboration, and even patient leadership.
A dedicated resource center on patient engagement, including use case videos, has been developed to help you get started with patient engagement in research and can be found on patient-engagement.eu. There is growing interest in funded research in the degree to which digital resources adhere to the goals of FAIR, that is to be findable, accessible, interoperable and retrievable. And therefore it is recommended to implement FAIR principles in research projects and involve FAIR expertise as early as possible. A dedicated video is available explaining FAIR data management principles and how best to verify your data using tools, resources and standards that align with the FAIR principles. For projects developing services, tools, training or infrastructure for the research community, it is important to consider early in the project how these outputs can be sustained. It is recommended to describe a sustainability plan for the project outputs and sustaining data from the project long term, including any plans related to commercialization, early health technology assessment, regulatory assessment and CE marking. A business model canvas is a useful tool to collect data on the key resources, partners and channels, as well as costs and revenues needed to maintain the outputs.